Transforming care through genomic medicine, personalized therapeutics, health services and outcomes research, and innovations in healthcare delivery. We're Children's Mercy Kansas City, presenting our audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
Welcome to Transformational Pediatrics. I'm Dr. Michael Smith, and our topic is a multidisciplinary approach to feeding issues. My guest is Dr. Sarah Edwards. Dr. Edwards is a pediatric gastroenterologist with special interest in feeding disorders and nutrition. Dr. Edwards, welcome to the show.
Thank you.
So how big of a problem are feeding issues in the infant and pediatric population?
It is quite a common problem. We see about 25% of children, just in general, have feeding problems, with about 3 to 10% of those having more severe feeding problems. And then more specifically, about 80% of that population seems to be in the developmentally delayed or intellectual disability type patient population.
And so how do you go about identifying a feeding problem, and what are the most common causes that you see?
Well, typically when we're seeing a patient, we're seeing, a wide variety of diagnoses that are contributing to their feeding problem. And we see really everything from children with severe picky eating that can be contributing to their feeding problem, to such diagnoses as eosinophilic esophagitis, reflux, structural problems that can contribute to not being able to eat and drink at their developmentally appropriate level.
Yeah, so you're seeing quite a spectrum of
yes.
patients, aren't you? From just simple issues to downright pathologies, correct?
Correct, yes.
Yeah. So tell us about, you describe your feeding clinic as multidisciplinary. What do you mean by that, and why do you think this type of approach is really important?
So, when we say multidisciplinary, we really are indicating that the patient is seeing 5 different disciplines in one office visit. This includes myself, a psychologist, a speech-language pathologist, occupational therapist, and a dietitian. And this gives us a tremendous advantage, both for us as providers, but also for the patient. With regard to the providers, we can then discuss our plan, our assessment and plan, and make sure that we're all taking into account each other's recommendations and assessment, which can affect our treatment plan as a whole. And then the patient is not having to go to 5 different appointments. They have one unified treatment plan that is developed by the full team.
And how do you involve the parents in this process as well? Are they, I'm sure they're obviously with the child, but what do you do specifically to address the needs of the parent in this clinic?
That's a great question, because we do talk very a lot during the visit about the importance of the parent's role, and that really they are the advocate for the child, and we see this as a team approach, and they're one of those players in the team.
Right.
And so when they're leaving the visit, we want to make sure that they have a full understanding of what the treatment approach is, and that the map for how we see their child getting better or treating the feeding problem. That we watch the parents feed their child during the visit, so that we can also have some insight into that interaction and how that could be affecting their feeding problem. And that's also where our psychologists can be quite helpful in monitoring both the stress that's involved in patients with feeding problems, and also, helping the parent with any of those behavioral questions or those kinds of strategies.
Is there any follow-up for the parent and what you've taught the parent in terms of feeding techniques? Is there any follow-up at their home through maybe a social worker, or do they always come into the clinic for follow-up?
So they always come into the clinic, but we try to work very closely with the providers that are in the community. So a lot of our patients are being followed by the 0 to 3 services in their community. And so, we see quite a few patients that drive a significant distance, and so we try to work with those community providers in the interim between visits to really make sure we're making progress and consider them an extension of the team because they're the ones really seeing the patient every week. We do also have some patients that live closer that will see 1 or 2 members of the team weekly in between, the visits with the full team.
Well, let's walk us through, a typical visit then with one of the patients and speak to some of the strategies that you use for addressing feeding problems.
Okay. Well, the initial visit, we ask parents to bring both preferred and non-preferred foods for the child. And, we see such a wide range of patients. Some of our patients are not taking anything by mouth when they see us initially. We definitely are willing to see, any patient that is having feeding problem, no matter what the level of feeding is when they initially meet us. And so, with the initial visit, the parent and child is in the room with the full team, and we are asking them, about family history. We have them fill out a packet ahead of time, and we use that to guide a family history, physical exam, and really allowing that to guide initial questioning. And then when the patient has warmed up a little bit, we will oftentimes ask the parent to go ahead and feed the patient, and our feeding therapist will then oftentimes work alongside the parent or interact with them to also get a better idea of the oral motor skills that the child has. And then once we've completed that history and physical and the feeding assessment, then we typically, discuss as a team what the best strategy, first of all, our assessment, and then the best strategy for a plan to reach the goal. Because I failed to say one of the first things we ask parents is, what is your goal? What would you like to accomplish in being here? And so we really want to target that goal, and that can look different for every child. For some children, it can mean, social eating, having a few bites with their family at a meal. For some children, it can mean weaning them completely off of their feeding tube, or just expanding the level of, foods that they're actually taking.
So in this approach, where in one visit you're seeing 5 different disciplines, you work together as a team. I mean, you're saving obviously a lot of time, because before your clinic, the parent and the patients would have to go to 5 different office visits, which can be very difficult. So this is a wonderful approach, and I know you're doing some awesome things there. How do patients get to you and the clinic? How do they find out about it? How do they get referred to you? Where do most of your patients come from?
So they can be referred from their primary care physician. They can get a referral from, if they're being seen in Children's Mercy. Oftentimes, they can, if they see a provider that thinks they need to be seen in the feeding clinic, they can get a referral there. They can also call our contact center at 816-234-3700, and that's where the providers can make a referral, as well as on the childrensmercy.org /providers. And then you can select make a referral, and providers can also refer through that portal.
Well, Dr. Edwards, I want to thank you for the work that you're doing, and thank you for coming on the show. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Michael Smith. Have a great day.